many people living with disabilities, pain management is deeply personal and requires approaches that respect individual needs, preferences, and experience.
Good morning, good afternoon, good evening, everyone, wherever you are on this beautiful panel that we call home. So here we are talking about the rise of alternative medicine, patient-centered care that transforms pain management. I do understand from the marketing team that this particular session has created a lot of excitement. Some were flabbergasted as well, I believe. And a lot of the response that we received was that they were a bit surprised that we would be talking about this session as well. So let's start by reminding us that the hardest part of advocacy indeed is talking about the real challenges that we face. People with disabilities have so many challenges that they have to live with, some from birth, maybe even during conception. Perhaps one of our panelists will correct me if I'm wrong, because that is exactly what he does. Maybe after an incident, an accident. But when we look at holistic health, we have to understand that there's more to who we are in terms of our physical health, our mental health, our emotional health, and above all, our spiritual health. So before I introduce my wonderful, wonderful panel, which was curated and is joining us from Kenya, mainly. Two of our panelists are from Kenya, two are from the USA. We're going to see how both these countries look at holistic approach. But before that, there's so much that we have been listening to, learning, and engaging with. So let's take a breather to live in the moment and appreciate our own life journeys in this safe space of acceptance and unity in advocacy. I would like to request the technical team to please put up our special meditation video before we start our session. So you will see before you the image of the triangle. Music provides us. We breathe in, we hold, and let's just breathe that giving to live in this moment. Let's breathe in, hold, and breathe out. Breathe in, hold, breathe out. Remember, breathe in, hold, breathe. Take your time. So I hope that helped you to rejuvenate just the way it helped us. You can see my panelists are smiling, and so am I. And that is the power of conscious breathing. The first step towards self-healing, self-advocacy is when we take care of ourselves and our health. So allow me to introduce my panel now. As I said, the panel represents voices from both America and Kenya. Although our countries differ in their healthcare systems, legalities, insurance coverage, and cultural beliefs, we are witnessing a common global trend. More and more patients are seeking holistic approaches to health and rediscovering forms of ancient wisdom that have been supporting communities for generations. would also like to remind our viewers that this panel is here to share their knowledge based on their expertise. This is for us to share our love, our care, and the divine blessings that we have received. We are sharing this with the world as a gift. So please do receive it as a gift. Thank you. So I would like to begin by introducing my panel. I'm sure you're very excited, just as I am. So in no particular order, allow me to introduce to you the first person that I am seeing on my screen, which is Dr. Glenn Mendoza from the United States of America. He is a highly accomplished neonatologist and associate clinical professor with 30 years of experience directing the NICU at Good Samaritan Hospital and managing early intervention programs for children with disabilities. Alongside his medical career, he is one of the only 8 master pranic healers, which is energy healing, globally, leading organizational development and outreach for the energy healing modality. Recognized as a top medical doctor in New York for over a decade. In fact, he's been in it for more than 20 years, is what he had mentioned when we had our initial discussion. He continues to expand his professional credibility and network into new domains. There is so much he's doing. He just mentioned there's something that he's also doing for cancer patients, and he's charting new pathways through his work. So thank you, Dr. Mendoza. Thank you so much for joining us today. Thank you. Next, I would like to introduce Dr. Dinesh Varsani, who is based in Nairobi, Kenya. He is a practitioner who provides natural wellness support through traditional Ayurvedic therapies, holistic bodywork, and naturopathy. His vocation encompasses offering specialized services, and I hope I'm going to say this right, like the Shirodhara, acupuncture, acupressure, and custom wellness packages alongside curated herbal product guidance for many ailments often related to pain, issues, and management. One of our youngest panelists next is Neal Dodhia, and I will say it in the same breath. He's also from Kenya. So as I welcome Dr. Dinesh, Karibu sana, Neal as well. He is, as young as he is, he's an established alternative wellness practitioner and a pioneer in sound therapy within Kenya, offering over 20 years of experience in holistic healing. His clinical practice integrates a diverse range of specialized modalities, including Reiki, Tibetan, Bowl, and Gong resonance therapy, crystal reflexology, therapeutic bodywork, and trauma-informed emotional release. Utilizing an intuitive client-centered approach rooted in traditional wellness practices, Mr. Dodhia specializes in facilitating deep restorative care, stress mitigation, and comprehensive emotional and physical ailment. Welcome. Last but not least, thank you. I know we always start with the ladies, but I wanted to give a special introduction to Dr. Melanie Joy, who is a board-certified holistic clinician with over a decade of experience in functional nutrition and integrative health, living in Pensacola, Florida, USA. Through her private practice, she uses a personalized root cause approach to support both the physical and emotional well-being of her clients. So welcome And thank you so much once again for accepting our invitation. Thank you. I want to jump right into the questions because I know my panel is ready. So I would like to begin with a question for each one of you. And the question is that from your perspective, what does healing truly mean, especially for persons living with disabilities or chronic pain? May I ask Dr. Dinesh Varsani to please go first? Thank you.
Thank you so much for giving us a golden opportunity to share our experiences and views on this. Well, the difference between healing and cure. Now, as far as the disability is concerned, the chronic pain through lifestyle and life awareness is basically better to look into it. Whereas Ayurveda, the science of an ancient Indian philosophy, Ayu means the entire lifespan, right, from conception to death, and Ved means knowledge about it. So Ayurveda basically tackles the entire lifespan of a human being, where Ayurveda firmly believes that a human body is made up of 5 universal elements: earth, water, air, fire, and space. The combination and permutations of those 5 elements results into 3 constitutional energy, which is known as Vata, Pitta, and Kapha. Now, Ayurveda, as far as health and healing is concerned, it believes that a human body's health is not achieved only by physical health. It is mental, physical, emotional well-being, whereas Ayurveda believes that your physical body health is basically determined by proper secretions of your stool, urine, sweat, and balances of all the 3 doshas. That is Vata, Pitta, and Kapha, which are those 3 constitutional energies which determines a human body as a whole. So where the healing and cure comes in a disability, it's very difficult because the disability is basically a permanent condition, where what we can do as Ayurveda is concerned is try to balance the doshas. Suppose if there is too much of pain, that means there is aggravated vata, there's excess vata. So that is causing either obstruction, dryness within the system. So you look at how to specify vata, how to reduce vata so that there is less pain, there is less stiffness, there is less wear and tear in that area. So how you can achieve that is by applying little bit of warm oil, gentle application, because in disability cases, most of the time over my 30 years of practice in this field, we have seen that where there is a disability, there is a lot of inflammation due to wear and tear. And what happens when there is an inflammation, you do hard massages or deep tissue massages, you create more damage and more pain. So what Ayurveda suggests is gentle warm application specifies vata, so the stiffness and pain reduces. Mainly the best oil recommended by Ayurveda for vata specification is simsim oil. But you can also use coconut oil, mustard oil, even castor oil, which also gives fantastic results in inflammation. So this is one way. The other way is dietary regime. If you follow the diet, what a vata specifying diet, mainly warm and lubricating diets, which reduces vata. Then your dincharya means your daily routine, sleeping on time, waking up on time, eating on time. These are things which you need to observe properly so that the three constitutional energies are well balanced and they function properly. So basically, people with this disability, what I have seen, because I am one of a parent with a special child. My son is already 26-year-old. He was born with the hearing disability. And the earlier panel, what I was listening to, well, I've gone through all that, what they have discussed. So basically, one has to, as a practitioner or as a caregiver, when you're taking care of disabled patient, you need to look at their mental, emotional well-being. You have to find out purpose and quality of life. You see, I always believe that disability is not an inability.
True.
You can always achieve a meaningful purpose of life. So by what happens is Ayurveda helps to achieve self-confidence by reducing vata or balancing all the three constitutional energy. So mental health is also achieved through balancing the doshas. Basically, when the vata is excess, what happens? Person becomes restless, forgetfulness, and all that. So Ayurveda basically believes that one should not limit its physical status. You can rise above that physical limitations, and you can grow in your day-to-day life, and you can do a lot for the society.
Thank you. Thank you. Thank you for even clarifying that you're talking about the physical disabilities. It is good to specify. So thank you so much. And thank you for advocating for your child as well. Thank you, Dr. Dinesh. Dr. Mendoza, I'm sure you have a very different approach to that. So please do share your views on that as well.
I think I'll describe it into two ways. As a medical doctor, I think medicine looks at health as actually a state of well-being. It's a state of well-being, not only of the body, but of the mind. So that is actually health. Or if you have to add, I think one of the description of health is absence of disease. So this is where our disability, our understanding of disability. Now, I am also, as Sonia mentioned, thank you very much, Sonia, that I am also a practitioner and a teacher of energy. So as far as energy is concerned, it's related to health. If I cannot move my arm, that means energy is not flowing. But if energy is flowing, I could have movement of my arms. If my relationship is not good, energy is not flowing. So if society is deteriorating, energy is not flowing. So from an energy point of view, energy has to flow. In health, energy has to flow. Thank you.
Interesting. Thank you. So when I look at both Doctor and yours, when he's talking of vata, that vata, I believe, is the air aspect of the body. That in itself explains also the energy aspect and how it's all integrated. So thank you so much for that, both Dr. Dinesh and Dr. Glenn. Thank you so much. Neal, what do you think? What's your
as Dr. said, the energy. So I believe in energy as well, and one of my biggest practices is involving energy and the mental wellness, because energy, when you deal with energy blocks, when we deal with that, and we deal with the physicality and the mental wellness, it's all integrated. So when you're working with energy work and you start receiving and blocking the energy blockages, your physicality starts changing and transforming. When this transforms, your mental wellness even, because energies take care of the mental, physical, and emotional side. So all these three aspects is taken care of. And when disability comes, when I understand, there's a lot of stigma, there's a lot of, how do I call it, mental, physical, and emotional blocks that create. When we deal with it in the energy way, it really helps open up the person, gives them confidence, gives them the boost, and helps the disability to become not a disability, but an ability to fight the outer world. So I start like when a person with disability comes, is you really have to mentally even give them the courage and confidence to help them fight the outer challenges of the world, because that is one of the things you really mentally even have to give them a boost. And with emotional and energy work, it just helps you open up and receive. Yes, challenges are there, but more than challenges, acceptance is very important. So when you accept, okay, this is what is the reality, and now how do I come forward and make the best of what I have? And with the support system, with the family support, and the environment, everything changes. So I believe that it's very, very important to take care in all three aspects, not just the physical or emotional, but the mental is very important as well.
Thank you.
Yeah.
Thank you. So basically, we're talking about the energy in the form of how we conduct ourselves, how we
Yes,
view
the
ourselves,
self-love.
how we talk to ourselves, what do we
Yes.
tell ourselves,
Yes,
and
exactly.
the power that we hold within ourselves.
Within
right?
us, yeah.
Okay, thank
Because
you.
this inner,
So the video-
this inner,
No?
the power we have, as a healer, I love to emphasize in expanding it even more, and that magic happens then.
Magic. Interesting word. So the three modalities talk about almost the same thing, because both the doctors said that physical health is there. There's that aspect, and then there's the energy aspect, which is coming in from now the emotional state, and then you're talking about the mental state, and we're seeing how everything is now integrated. So thank you so much, Melanie Joy. I just love your name, first of all. Let me just say that. I love the joy that you bring when you come on camera. So please share your views as well on this.
Absolutely. Thank you so much, Sonia. For many individuals living with a disability or chronic pain, healing isn't always the complete elimination of pain or the absence of a diagnosis. From my perspective, healing is about increasing the quality of life. Success may be sleeping through the night for the first time in months. It may mean walking a little bit farther. It may mean participating in family activities, having enough energy to prepare a meal, or reducing reliance on certain medications. Simply feeling more in control of your health instead of feeling controlled by it. As a holistic clinician, I believe healing is about supporting the whole person, not just their symptoms. That means looking at nutrition, sleep, stress, movement, relationships, emotional well-being, and the nervous system, because all of these influence how we feel and how we function. Complementary and integrative therapies don't replace conventional medicine. They expand the toolbox. They offer additional ways to reduce suffering, to improve resilience, and help people function at their highest possible level. To me, healing isn't about becoming symptom-free. It's about creating more good days than bad days. It's about helping people reconnect with their bodies, regain hope, and experience more joy, purpose, and participation in the life that they want to live.
Interesting. Thank you. So you again talked about almost the same aspects of the emotional well-being, and then there was the mental where, you know, the stress and everything was coming in. And then you went a step further to say the good days that a patient living with disabilities. And when we talk about disabilities, in the world of disabilities, we have it in different forms. We have everybody who is living with disabilities, as the panelists before us said, they know their body. Nobody knows their body better than them. Nobody understands what they're going through on a daily basis, but they do. And I admire and I salute every single person living with a disability, fighting for themselves, fighting for others, advocating for others. This is why health summits of this kind are so important for the global world of disability. So thank you so much. And I'm sure our viewers have noticed that our panelists tend to have some aspects where they are integrating, and there's some aspects where they have a very different approach to healing. And that is why this conversation becomes very interesting and bold in its own right. What defines it for us? So I'm going to now go into the main questions. It seems, Neal, you'll be my first panelist. I'm just intrigued at how young you are, and yet when I have a conversation with you, anytime I do, you always bring a new perspective to so many challenges that we face on a regular basis, whether there's a disability or not. I believe, as Dr. Dinesh said, disability is not an inability, but at the same time, disability is a different ability. Without my specs, I'm blind. This is my disability of one kind. I am an ADHD brain. I can do 100 things at the same time, but I'll not concentrate on one single thing. That becomes my superpower, and it also becomes my downfall. But now I want to go into your main question, which is, many of our audience members here, our Rotarians, have experienced an accident, illness, or an event that changed their lives forever. And that happened in a split of a second. How can practices such as sound healing and other multidimensional approaches help support emotional well-being and improve quality of life as they learn to adapt and move forward?
Wow, thank you very much. That's an interesting question. I've worked with a lot of disabilities, as you said, not just, major, even small disabilities like without your glasses. We get so stressed. We get so imagine the ones who've had everything and lost, has become disabled all of a sudden. The emotional impact that happens in the physical, mental, and emotional mind, body, and soul is a trauma, and it changes a lot. So there's so much of emotions holding up, and sound therapy is one of the ways it's a beautiful technique to actually help in energy work and physically, mentally, emotionally to accept the challenges, to de-stress and open up to, in a positive way, to basically live and accept this challenge that they have in front of them. Because the body is a vibration, right? When this stress is so much, the vibration level becomes low. You're working through a very low pain. You're working through a very low energy system. And sound helps you because our 75% of the element is water element in our body. It's the highest element that is in our body. And sound and water becomes so beautifully integrated. Yeah. So what happens is it starts changing the molecular pattern, starts changing the brain waves. When you're emotional, when you're going through so many challenges of life, the brain waves become so dull. We become so disorientated. This changes the pattern of the body, changes the state and consciousness of the body, and helps them, lift their energy system, starts bringing positivity into the body by these cells are absorbing positive energy, because the sound waves that are created with all this kind of frequencies is beautiful healing energies. And your body starts taking in. So you start feeling good. You start releasing emotion and understanding that, okay, it gives you a boost how to face the reality. And when you're healing with all these modalities, like so many different kinds of modalities, it starts changing your emotional state, your physical, mental well-being, because you start feeling good. Once you start feeling good, you start opening up to a beautiful dimension of positivity. It gives you a boost. And that's when you start slowly accepting what the challenge right now is. And what I believe in, what I do, I practice a lot, because I've been to so many challenges myself. And I only teach what I have gone through and I've understood to person coming with disabilities or challenges in life. Is really, we need to sit with us, understand where we are at this point of life. What is, we are so fortunate, even with a disability, there's so much good into it as well. So accepting it first, and from there taking it forward and working with energy and all that, if life becomes more positive, life challenges becomes more less, and opportunities become more, because we learn how to make the most of it with ourselves. So in the present moment. So that's one of the important factors is living in the present moment. And when you start living in the present moment with energy work, it just supports you. It just brings a lot of love, a lot of healing and openness to get out of the situation you are. And rather than becoming sorrow, sitting there and depressed, all this energy work that you do, or any kind of modalities that of mental or physical modalities that help you boost up, basically, to help you become more productive, energetic, and come up with a positive way of living, rather than just sitting there and feeling sorry for yourself.
It's tough. We've worked for years with people with disabilities, but I do hear you, because as I say, the greatest warriors in today's day and age are people fighting for themselves every single day and fighting for others like them. So, Neal, you've talked about reflection, you've talked about gratitude, and those are two. It's difficult, but it's possible.
Yes.
That is something I have personally learned from our group of our team of Rotary Club of World Disability Advocacy. So thank you for reminding us that once again. So thank you. So let's change our approach a little bit. We come back to you, Dr. Melanie, because I want to talk to the doctors after this. As a holistic clinician, and of course the solo female voice on our panel, how can functional nutrition and lifestyle medicine then support individuals managing disability, and in particular, chronic pain, as Dr. Dinesh had said, that there's some ways that we can help with the physical aspect of it, but then chronic pain comes in different forms and different strengths for everybody. So particularly mothers and primary caregivers, for them, their pain is beyond human capacity, as we would put it. And these mothers and primary caregivers face the unique emotional and physical demands of caregiving while navigating their own healing. We are not just advocating for people with disabilities here or children with disabilities here. We're now also talking about, what about that primary caregiver? What about that parent? Yes, we are advocates for our children who have disabilities, as the panel before us did, as Dr. Dinesh was talking about. But from your perspective, first of all, let's understand how functional nutrition and lifestyle medicine supports individuals managing disabilities and chronic pain, and then, in particular, mothers and caregivers, how can we help them through the emotional and physical demands?
Absolutely, Sonia. Thank you so much. This is such an important question. When we talk about disability and chronic pain, we often focus on the individual experiencing the diagnosis. But we don't talk enough about the health of the caregiver that's standing beside them. As a holistic clinician, many of the women that I work with are mothers, wives, daughters, or caregivers. They are coordinating appointments, advocating for service, managing medication, handling household responsibilities, and often putting their own health last. Caregivers often become experts at recognizing everyone else's needs while slowly becoming strangers to their own. One of the most important things I want people to understand is that caregiving itself can become chronic stress exposure, which increases inflammation. Research consistently shows that caregivers experience higher rates of anxiety, depression, sleep disturbance, immune dysfunction, chronic pain, and diseases than other non-caregivers. In fact, research from the caregiving literature has shown that chronic caregiving stress is associated with increased inflammation and immune dysregulation. Studies have demonstrated that chronic caregiving stress alters immune function and increases inflammatory markers. This helps us understand why caregivers often experience declining health over time. What I appreciate about functional nutrition and lifestyle medicine is that they ask different questions. Instead of asking, what disease does this person have? We ask, what is burdening this person's physiology? What is depleting their resilience? For many caregivers, the answer isn't one thing. It's often a combination of sleep deprivation, chronic nervous system activation, nutrient depletion, blood sugar instability, a lack of movement, social isolation, and emotional exhaustion. When we begin supporting those foundations, we often see meaningful improvements in quality of life. Sleep, as an example, is one of the most powerful yet overlooked interventions. And the research consistently shows that improving sleep often improves pain, mood, cognition, and daily functioning. Nutrition matters too. Dietary patterns rich in protein, vegetables, fruits, legumes, fish, olive oil, and nuts, and minimally processed foods have been associated with lower inflammation and better overall health. The goal is nourishment. I tell my clients all the time, your body isn't asking you to have it all together. It's asking you to be cared for. Sometimes success looks like adding protein to breakfast or sitting down for one balanced meal a day. Sometimes it's taking those small changes matter because overwhelmed nervous systems often respond. Another area I focus on is the connection between chronic stress and the nervous system. Many caregivers live in a constant state of hypervigilance, waiting for the next appointment, the next crisis, the next phone call, or the next symptom flare. Research in psychoneuroimmunology has shown that chronic stress influences inflammation, hormone signaling, and pain perception. This is why lifestyle medicine includes things that may seem simple, but are biologically powerful. Walking, time outdoors, breathing practices, social connection, gentle movement, mindfulness, and restorative sleep. I also think it's important to acknowledge something we don't discuss enough. Not every symptom is a nutrient deficiency. Not every symptom is psychological. And not every symptom requires another supplement. Sometimes the body communicates that it has been carrying too much for too long. Before I close, I'd love to leave caregivers with 3 practical takeaways. Nourish yourself before you nourish everyone else. Those small acts tell your body that you matter too. Second, schedule appointments where your only job is to receive. Whether it's massage therapy, acupuncture, craniosacral, or another restorative practice, make those appointments a part of your healthcare, not a reward you have to earn. Caregivers spend so much time giving that they often forget what it feels like to receive. And finally, don't wait for life to slow down before you care for yourself. Many caregivers tell me, I'll focus on my health when things settle down. But for many families, that season never comes. Instead, build small moments of restoration into the life you're living today. 5 minutes outside, a short walk, calling a friend, going to bed a little earlier. Healing begins with consistent acts of self-care. Functional nutrition and lifestyle medicine are not replacements for conventional medical care. Rather, they are tools that help us support the whole person. When caregivers are supported, everyone benefits. The child benefits. The spouse benefits. The family benefits. and the community benefits.
Thank you. You spoke to, I know you spoke to many, because this is something that a lot of the caregivers tell us, that we forget ourselves when we are caring for our loved ones. I know I'm saving the best question for the last, for sure, because I keep imagining what happens to a mother who's just given birth and, you know, and sees her child with, you know, with pipes and everything. I keep asking myself, what is going through this mother's heart? What happens to a mother who's just given birth and she's told that your child will live with this condition for the rest of their lives? And as Neal was mentioning, that it's acceptance. And that is the hardest part of parenting. The hardest part of advocacy is acceptance. So thank you, Melanie, for reminding us, joyfully that is, reminding us that we really do need to take some time out for ourselves. Healing also begins with how we treat ourselves. So thank you so much for speaking for them and reminding us about the nutritional value of what we put into our bodies. It's very hard. There's a lot of stress eating that we do. And so it becomes very difficult for us to put ourselves in their situation, in their position. But what we can do is create community for them. We give them a support system that they can rely on. Just give them a shoulder to cry on or an ear to listen to them. So thank you for reminding us about that. Thank you so much. Dr. Dinesh, you know, there's something Melanie said that is connected to your question. So I do know the right way to address you is Vadji, which is a title given to the doctors who have undergone the Ayurvedic healing, you know, training, if we may call it that. We know that Ayurveda and yoga, which has taken the world by storm, I must say, it's become a global phenomenon. When you look at the International Yoga Day, how everyone is celebrating it, everyone has embraced it. It's so beautiful to see how humanity has embraced each other's way of working. And we know that each one of you, by the way, is talking about an ancient wisdom. So, Dr. Dinesh, Ayurveda and yoga emphasize treating the whole person rather than suppressing a symptom. And I'm not saying that that is what happens in the medical field, but I'm saying more or less it is even us ourselves who do not come forward and say, I am going through these challenges. And that just keeps on adding into issues. For example, if my knee is hurting and I keep ignoring it, eventually I'm going to have a challenge, and, you know, disability would also come in old age, not just somebody young. It happens with the older patients as well, when you know their bodies are not able to sustain the strain over and over again. So for such individuals living with permanent disabilities, managing chronic pain even in old age, how can they use basic Ayurvedic principles, gentle yoga, to listen to their bodies, restore internal balance, and ultimately live a more meaningful life despite the pain that they're going through?
Basically, I think the panelists before me, they have already mentioned, I think, 70% of what I wanted to say in terms of energy. And so basically, when somebody is living with the pain and the stress related lifestyle, what happens? Your body gets adapted to that sort of stress memories. So to them, it is like it's a normal thing on day-to-day life. Suppose if I'm suffering with the knee pain, the mild knee pain, it's like it times comes that I've accepted it, there is that pain. So the body gets accustomed to that sort of memory, that this is what it is. So whereas one has to also understand how to re-educate your body to relax. The stresses are always there in day-to-day life. We live in a era where stress is inevitable, but how you can increase the threshold capacity of your body or the body of patients to absorb more stress and tension, rather than saying that don't take stress, because stress are always existing one way or the other. Whereas now Ayurveda and yoga comes in, as I said earlier, Ayurveda is basically a science of an entire lifespan, the knowledge of a lifespan. That's what Ayurveda means. And Ayurveda means that human body is an epitome of Mother Nature. So creating a synchronization with the nature around you in terms of breathing techniques. I think someone also mentioned that the breathing techniques helps you to synchronize your two nadis, Ida and Pingla, sun and moon, yin and yang. It creates synchronization. Yeah, there are different techniques of breathing in yoga where you can balance your nadis and also the energies within the system. So performing that yoga gentle breathing techniques helps you to resolve so many of the stresses within the body, like Bhamri. When you close your eyes, close your ears, and just chant a humming sound of Om, gives a tranquil feeling of the entire nervous system and the body. So there's so many asanas, there's so many breathing techniques in yoga to create harmony and synchronization with nature. The same way Ayurveda, in terms of herbal preparations and the day-to-day living, as I said earlier, that dietary regime, my first prescription to all my patients is diet, because what you eat is what you are. Basically, if you're going to eat junk and diet that is going to consume a lot of energy and time to digest within your system, it's going to deplete your inner energies, because every grain you put needs energy to digest, assimilate, and utilize. So it is very important what you are going to put into your body and what you're going to get. So dietary regime is very important in maintenance of your health and vitality. The same way, gentle stretches, guided stretches, yogic chair yoga, or all this for the people with pain and disability can help to improve movement, reduce stiffness. Diet can help to reduce inflammation. Inclusions of something like turmeric, ginger, clove can help to reduce inflammation and vata. As I said earlier, the three doshas, vat, pitta, and kapha, are three constitutional energy, what makes you as a person. The same correlation you give it, that it is yin, yang, and chi. That is vat, pitta, and kapha. It has the same characteristics in both the modalities. So it is how you create a synchronization in all the three doshas through your diet, through your dietary regime. Your daily dincharya, which is a Sanskrit word, means that your day-to-day activities, the time to sleep, time to eat, time to relax, time to get up. If you have a specific time, which is your daily routine, exceptions can be there, but on a normal basis, if you can create that sort of routine lifestyle, it helps your body to adapt, heal, and synchronize the energies which are not in balance. Then, listening to the body's wisdom, what is aggravating and what is calming. So you learn to listen to the body. I always tell my patients that you have to become your own doctor. We are here to guide you. We are here to share whatever knowledge God has given us to share and help you. But you have to listen to your body. Because I think earlier panelists say that a person who is suffering lives with their own body, so they know better how their body is working. So here the wisdom of listening to your own bodies comes handy for you to handle these situations. Now, the most important thing is that physical disability can limit the movement, but it can always be improved by looking after it or working on it. So I just, if we go on to this subject in detailed wise, it becomes so long. So I'll just summarize it in simple way. Ayurveda and yoga looks at how to harmonize the body is three energies, that is Vata, Pitta, and Kapha. Basically, Vata is responsible for the movement, stagnation of energy, stagnation of circulation of blood, fluids, lymphatic system. So if Vata is vitiated, it will cause obstruction, it will cause uh, wear and tear. So once you reduce that, I think Dr. Glenn mentioned about energy stagnation. When the energy is not flowing properly, the movement is restricted. The same way Ayurveda believes that when Vata is stagnated or Vata is vitiated, it either causes obstruction or excessive movement. Like in Parkinson's conditions, there is excess Vata. So the movement is uncontrolled, and it is the people who go through Parkinson's, they have a terrible sleep pattern. They cannot even eat properly. All those things, it's because of excess of Vata. So if you can create that equilibrium of three doshas, Vata, Pitta, and Kapha, the harmony of the body will automatically be there, because Ayurveda believes that a human body is an epitome of Mother Nature. When there is heat outside, there is heat inside. When there is rain outside, there is more water inside. When there is cold outside, there is cold inside. So listening to the nature and the body, there are so many ways of doing it through even herbal preparations. Like there are herbs like Triphala. It is a combination of Amla, Herde, Berde. These are three myrobian fruits. So it has a powerful impact on the body to synchronize the three doshas. So Triphala actually balances Vata, Pitta, and Kapha. Yes, it has other benefits, like it works as a mild purgative laxative. So there are simple herbs like that also can help you to create balance. There are herbs like Nirgundi, which you can use it as a hot fermentation poultice to reduce Vata, can be taken orally also to reduce Vata, so that it reduces inflammation and pain. So Ayurveda it is an ocean of knowledge as far as the health is concerned. And nobody knows when it was not existing. People said that it is 5,000-year-old, 10,000-year-old. But as far as when I'm studying the Ayurveda more and more and more, it is, you are coming to understanding that it was, there is no time that it was not existing. It has been there since the time of creation of this universe. So what we could look at it as Ayurveda is concerned and the yoga is concerned, the simple breathing technique, the gentle asanas, gentle chair yoga movements, and guided stretches, and dietary regime, and uh, gentle oleation. As I mentioned earlier, that symptom oil is considered to be the best anti-Vat oil. The same way honey is considered best anti-cough remedy. And ghee is considered, the clarified butter is considered as the best anti-pit element. So that way, there are so many things which you could implement into your day-to-day dietary regime, which can help you to create synchronization and equilibrium of the doshas.
Thank you, Doctor. You're right. It is an ocean of knowledge, and you're right. When we work with nature and not against nature, we feel good. We feel better. I know there are other countries that have the 4 seasons, and the global, weather pattern changes affects us. It's true. You're very right about
In
that.
fact,
So thank you.
In fact, Ayurveda also says that one should eat as per the seasons. There are different fruits, there are different dishes you prepare for different seasons. So Ayurveda has gone into the minute details of what you should eat in the morning, what you should eat at lunchtime, what you should eat in the evening. In a rainy season, what sort of food you should eat, and what are the methods of preparations in certain season for certain foods. So it is an ocean of knowledge. So for me to even go into the details of those knowledge, I think even the session will become boring and it will be too saturated. So I think, and if there is any other question you want me to specifically answer, otherwise I will leave it to this for the time being.
Thank you. I am being reminded that we're out of time. I did inform the team that I know this session will go long, but thank you so much. Thank you so much again for your shared so much, and I'm hoping that our audience managed to get some notes down. Dr. Glenn, you have intrigued me, you've intrigued my team to a different level, because, as I said, we've saved the last question for you, because this is something even we had not thought of when we were talking about advocacy for people with disabilities. You care for some of the most fragile patients imaginable to humanity. As a physician who embraces energy healing, how can conventional medicine and complementary approaches work together to provide compassionate, holistic care, especially when outcomes may include lifelong disabilities despite our best interventions? That is my first question to you.
Thank you. With this, I know we're out of time. I give the very short time I have. Let me just go into the deep dive into what my alternative work is, which is pranic healing. Pranic healing is an energy work. It's the fastest growing energy modality in the world, available into over 120 countries. We have it in East Africa, in Kenya, in Tanzania. We have it in West Africa. We have it in other areas also in Africa, and what was mentioned earlier of the global South. It's been practiced not only by physicians, but actually anybody who would like to learn about energy work. So it's a global work that I have. We could apply it actually, as have mentioned, I think what Thomas William Shakespeare in his keynote mentioned something about it's difficult to have a disability. It's very difficult to have disability. So we apply energy work. We could take care of pain. I did a major study in a quaternary hospital here in northern New Jersey, wherein we take care of pain in emergency room. So we could remove some of those pain. We could remove some of those difficulties. So we realize people go to the emergency room. They don't go with a toothache. They go with a major problem. And what happened was that, given with pranic healing, with the medications, with narcotics, it's even better than just the narcotics alone. That's one aspect. What I'd like to take care and probably submit and address to the group is one of the difficulties when we have somebody sick in the family, the whole family structure is affected. affected. Just think about it. If one is sick or in the hospital, everybody gets affected, even the child. So I'll tell you a story. I was in India one time, and a plastic surgeon came to me. I said, Master Glenn, because of pranic healing, I said, I have a patient who had multiple surgeries on the face because she had severe burns. What can I do? He's the plastic surgeon. I said, what am I going to do? I said, I'm not a plastic surgeon. Then I think what my area is, I said, do meditation. Tell her this. I teach meditation. What happened was that tell her to do this meditation. It's called meditation on twin hearts. Just do this meditation every day. And at the end, the meditation will not open only one's heart, but also do some healing. So I said, in the end, I want you to bless, number one, those who have been affected by cancer on the face, by injuries on the face, by any deformation in the face. And at the same time, I want you to bless all those beautiful people that you'd like your face to be in, the actress, the idols that we have. 3 months after I went back to India, this plastic surgeon has been looking for me. I said, I just want to let you know that patient is healed. She goes outside now. She feels good about herself. She accepted herself. So, and bottom line, on the lens of care, those who have disability, do meditation. Do meditation. Look at meditation on twin hearts. It will change you inside. You will accept who you are as is. And somehow there'll be healing on that aspect, energy healing, because the health will not only be on the physical level, not only on the emotional level, not only on the mental level, but only on the spiritual level. Thank you.
Wow. Okay. Interesting. Wow. Okay. So again, it goes back to how do we heal ourselves? What do we tell ourselves when we're meditating? How deep do we dive? Thank you for reminding us about that. I mean, that's awesome. So I'm coming up with a very, very tough question for you, Dr. Glenn, but I know you're ready for this one. How do you help families understand that healing and wholesome can still exist, even when a cure is not possible? Because I keep thinking about the child in the NICU. I keep thinking about what is this, as you said, the whole mindset, the whole, the whole person changes in the family, the energies, everything changes when one is hit with the news the first time that maybe there's no cure for this. How do you help them both as in your capacity as the doctor, a medical doctor, and then as a healer? How do you manage that?
Thank you very much. It's a very difficult. I've seen a lot of babies that are born severely deformed. They could have Down syndrome. They could have other multiple anomalies. Number one, I approach it on of course, it's a baby, and I just have to approach it on that aspect, and also look at it from the family's point of view. But this is just my selfish way. I just focus on what's best for the patient. Then later on, extend it to the family. On an energy aspect, on pranic healing aspect, or a spiritual aspect, sometimes we are given in a difficult position. This is all for those who have disability. We are given in a difficult position, but we don't know why. Sometimes it's not, this whole story is not given to us. So that's why I opted for some meditation, because sometimes you could see inside. This is who I am. This is what my lessons are. And to me, that's important. So for those who have disability, as Thomas Shakespeare said, go into grassroots, give it into your community, let them learn how to do that. And it's a difficult thing, and I salute the Rotarians International Rotary for this grassroots of disability and advocacy for those who who need help. Thank you.
Thank you. Thank you so much. I know the audience wants us to go on, but we have to respect that there is one more panel waiting up. I keep seeing their images popping in, and I honestly do thank each one of you. I know we are leaving this session as better human beings. We're leaving this session as better advocates for ourselves and for our loved ones. And we're leaving this session as better advocates for others. Each one of you has reminded us that indeed the power of healing is within us, and that we need to understand ourselves. We need to understand people who are going through these challenges. If we understand that, there'll be no stigma. That was one of the biggest challenges the policy panel were discussing, stigma. If we just accept ourselves and accept each other, there would be no stigma, there'll be no discrimination. We would understand that this person in front of us is suffering and we're here to help them out. So I do know we had a question after this, but I've been told that we are quite up on time. So allow me to share this reflection. To move beyond roles and disciplines and speak from shared humanity, where care, dignity, and presence meet. We believe this will create a thoughtful and uplifting close, reminding us of the heart of all care, improving quality of life for every being, every person. So with gratitude, we, the Rotary Club of World Disability Advocacy, would like to thank each one of you for sharing your time, your wisdom, your experience that has helped shape the outlook of many of our own who are struggling with chronic pain, finding solace and a safe space amongst their own thoughts and words. On their behalf, we thank you for your passion, gift, and vocation, and encourage you to keep spreading your beautiful life and heal the world. We look forward to another meaningful and enriching discussion with you in the future. I assure you of that. Signing out, Sonia Kaur Rajbans, the Chair for Inclusive Education Pillar for the Rotary Club of World Disability Advocacy. Thank you so much.